Welcome back to Season 3 of The Verdict. I'm your host, Tammie Smeltz, Content Marketing Manager with MLMIC Insurance Company. This year, MLMIC is celebrating our 50th anniversary. We are grateful for the opportunity to be of service to the New York healthcare community for a half a century, and we look forward to providing service like no other for years to come. Before we delve into today's episode, I want to extend a huge thank you to all of you, our listeners. We wouldn't be here without you. And because your opinion matters, we'd love to hear what topics you'd like us to cover next. Share your suggestions by emailing me at tsmeltz@mlmic.com or leaving a text on Buzzsprout while you're listening to our podcasts. My guest today is one of my colleagues and friends, Shelly Kriete. Good morning, Shell. How are you today?
I'm great, Tammie. How are you?
I'm good. A little bit cold up here in Buffalo, but what can you do?
Yeah. Well, thank you so much for inviting me to join in this program. I'm really happy to be able to talk to you about risk management and the site assessment today.
Yeah, you're welcome. I was really looking forward to our conversation. So can you tell our listeners a little bit about yourself and your role with MLMIC?
Well, to start, I have been in healthcare my entire career. My mother often reminded me that it said on my kindergarten report card I wanted to be a nurse. But let's really go in the reverse. That was several years ago. I was fortunate enough to begin with MLMIC in January of 2019. Before I started with MLMIC, I spent about the last 25 years in quality and risk management leadership roles in acute care systems here in New York. A little half of those years were for organizations who were insured by MLMIC. During those times, I worked really closely with my MLMIC risk manager, my claims representative, and my underwriter. I truly believe both my previous roles and my relationships with those folks at MLMIC then positioned me to provide meaningful risk management support to our New York policyholders. As for my role as a risk manager for MLMIC, my fellow risk managers and I, what we do will largely be described as we go through our conversation today. I'm one of 4 risk management consultants dedicated to supporting and guiding our policyholders through all things risk management, if you will. And many of our activities will be introduced through our conversation today.
Great. Thanks, Shell. So I know the MLMIC policyholders have access to an array of risk management services. What do these services include? Can you give us just a brief overview on all of them?
Absolutely. We have a wide array, as you said, of services with our primary goals helping our insureds mitigate risk and improving the care they deliver to patients. Our programs include customized risk management assessments, education, and publications, all offering solutions and guidance to our policyholders. All of our consultants have extensive experience and support our policyholders in a manner that really meets their needs. Examples, some of those activities include in-person, virtual, telephone conversations, which also include support from our legal team as needed. Our legal team is available 24/7 for the policyholders' risk management needs, and their focus is on mitigating risk as well as providing additional advice on other health law issues. In addition, we have a robust malpractice claims access to malpractice claims data. This is a significant resource for us to provide our insured organizations with custom claims analytical reports. And this offers additional support in developing tailored strategies for patient safety and risk management initiatives. We provide an array of on-site assessments looking at the operational processes at the facility or the practice that we're in, looking at it from a patient safety perspective. Educational opportunities and topics include CME-approved programs for our physician policyholders. 2 of our publications, named the Medical and Dental Scopes, cover trending issues, including case studies and other risk management guidance. And we also have published risk management tips and checklists that focus on common issues that arise in a day-to-day practice or other healthcare organization.
Great, thanks, Shelly. So all of these services, both risk management and legal, as well as the publications and the risk management tips, those are available to our policyholders at no additional cost, correct?
Absolutely, it is part of their policy premium.
So I think today we're going to focus on the organizational risk management assessment. What does that actually entail?
Well, to start, risk management is all about making decisions and implementing processes to support the prevention of adverse consequences or to minimize the impacts when an adverse event or loss occurs in an organization. A full organizational assessment could be as complex as the health system itself or practice that we're working with. We would be looking at areas related to general operations, human resources. Although we're not regulators, the consultants are not regulators. We are very familiar with the legal and the regulatory requirements and do incorporate that information into our review and discussions with our policyholders. Uh, Practices related to delivering general health care to the patients, like diagnostic testing or other procedures, follow-up, medication management. Also, practices related to delivering care to our patients, like diagnostic testing or other procedures that are done in the office or in the setting. Follow-up, medication management, chain of command, and informed consent are looked at. We also look at the use of technology, equipment, and other hazards that may offer risk or harm or loss to your organization. We do this by completing a facility walkthrough, looking at documents such as policies and procedures, medical charts, as well as interviewing staff. We also look at equipment use in the organization, infection prevention practices, and how appointments and telephone calls are managed, staff onboarding, and ongoing education and competency programs, just to name a few.
So, Shelly, that seems like a very all-encompassing assessment. And I know you mentioned policy and procedures. What would you be looking for when you're reviewing a group's policy and procedures?
For policies, we look at how staff access them. Are they educated about them in general? How are they reviewed and updated? Who the owner or content experts are? We may ask to review a policy based on something that comes up in our discussion. Examples of other policy documents we might want to see include informed consent, chain of command, event reporting, follow-up processes for diagnostic testing and referrals, workplace safety even and security, after hours coverage, patient discharges, and those sorts of things. Related to medication management, as an example, we may look at, are there any medications or samples on site? How are they stored? Are they secure? How are they inventoried and assessed for expiration? How do they get dispensed to a patient, if they do at all? We also look at who has access to the medications. Another area would most likely be a review of the medication reconciliation process. What is in place? Who is involved with that? How does the information get captured into the patient medical record?
I bet that's one of the most important aspects of the risk management assessment is looking at their medication guidelines, their review, how they document them, giving them to patients, and especially the samples, right?
Absolutely. Absolutely. Very important.
Now, once you complete your review, do you provide the policyholder with a written report? And if you do, what is contained in that report?
Yes, Tammy, we absolutely do create a report. In general, it includes a summary of our observations. Some of those items might include the type and the size of your organization, whether or not you have multiple services at your organization, provider types that are there, are they employed or independent contractors, things of that nature, the demographics of the practice, if you will. As I said earlier, this will be as broad or as deep as your organization is, whether or not we are looking at the entire organization, or maybe we're taking a more focused approach coming from a more focused perspective if you're having an issue in one particular area. For instance, maybe we're just looking at documentation, medical records, those sorts of things. Along with our summary, if we have any recommendations or suggestions for changes or plans to be implemented, new process suggestions, they also will be outlined for the policyholder in that report as well.
And the policyholder is not bound to make make any of the changes in your assessment, correct?
Most generally not. We are sharing what we have seen or know to be best practices and suggestions that we know from experience or looking at claims data, know that these are items that could in fact mitigate risk to your organization.
Okay, great. And what are the benefits of scheduling an organizational risk management assessment? Why would a policyholder want to do this?
Well, fundamentally speaking, one of the critical first steps and ongoing steps even in the overall risk management process is identifying and analyzing the risks within your own organization. And our assessments support you in doing just that. We've all heard the term nose blind. This is when you become accustomed to your surroundings. Things that you see every day may become less noticeable or even invisible. For instance, you might be stepping over an electrical cord day in, day out, or a frayed carpet or something like that, and not notice it any longer. But it could be a huge slip, trip, and fall risk for your organization. Having our risk management consultants come in provides you with a fresh set of eyes and offers an additional perspective to the atmosphere that you're working in. Although this may sound counterintuitive, I always say to my policyholders that one of my goals is to leave them asking more questions than they did before I came in. I want them to be able to have an outside perspective, a different way of looking at things. Those, as I said before, the fresh set of eyes, a different way of looking at your daily operations from the patient's safety perspective.
Okay, thanks. Now, if an insured was interested in scheduling a risk management assessment, how would they go about doing that?
Well, if you already know who your dedicated risk management consultant is, or you have an established relationship with somebody you talk to on a regular basis, you could contact them and let them know that you're interested in discussing having an assessment in your office. If you don't have a dedicated risk management consultant or don't speak to somebody regularly, you could simply call the 1-800 ASK-MLMIC, which is 1-800-275-6564, and ask to speak with one of the risk management consultants. You would then let them know you're interested, and we would in turn connect you with a consultant who would follow you through that entire process, which would include determining the scope of your assessment, what are you looking to accomplish, and how we could build that assessment to meet your needs.
Great. Well, thanks, Shelly. Thank you for being a guest on The Verdict today and for sharing all this valuable information, not only about our risk management services, but specifically the risk management assessment.
Thank you, Tammie. It's always my pleasure to work with you.
Yes, and it's my pleasure too. And hopefully we will get you back on the podcast again. And that's The Verdict on Senior Risk Management Consultant Shelly Kriete in MLMIC's Organizational Office Assessment. To learn more about the array of risk management services MLMIC offers to their policyholders, visit mlmic.com/risk-management. Thanks everyone for joining us today. I hope you enjoyed this podcast. Stay connected with us on Facebook, LinkedIn, and X for updates on our next podcast. This podcast is for general purposes only and should not be construed as medical or legal advice. This podcast is not comprehensive and does not cover all possible factual circumstances. Because the facts applicable to your situation may vary, or the laws applicable in your jurisdiction may differ, please contact your attorney or other professional advisors for any questions related to legal, medical, or professional obligations, the applicable state or federal laws, or other professional questions.